Hello guys, how are you doing? I hope you are doing well and welcome. Today we are going to learn about the hormonal methods of family planning, and they are three. We have Depo Provera, we have implants, and we also have oral contraceptives. So today we are going to learn about Depo Provera. Yes, very commonly used by so many ladies, and so it is a contraceptive method that contains a hormone similar to a female hormone called progesterone. So it is man-made, and it contains progesterone. This is a hormone that is produced by ladies, and its mode of action, it suppresses ovulation. Depo Provera, it is an injection that is given after every 3 months. Its mode of action is by suppressing ovulation. By suppressing ovulation, I mean it inhibits the ovaries from releasing an egg, and if an egg is not produced, then that means there will be no fertilization. So it also thickens the cervical mucus to keep the sperm from reaching the egg. So it is given as an injection after every 3 months. So you have understood that first of all, it inhibits the ovaries from releasing an egg. So we all understand that every female releases an egg every month. Okay, so this egg is the one that is fertilized by a sperm. But then the injection, the Depo injection, which has a hormone called progesterone, it inhibits the ovary from releasing an egg. And if there is no egg that is released, that means there is nothing that is going to be fertilized by the sperm. Number two, it thickens the cervical mucus, and once they become thick, the sperm will not be able to swim freely to the womb, so fertilization will not take place. So what are the benefits of using Depo Provera? Number one, it doesn't require daily action. Okay, for those people who forget easily, or those people who are forgetful, or those people who find it hard to take maybe a pill every day, Depo Provera is good for you because you don't require a daily action, okay, of taking it. Number two, it decreases menstrual cramps. Those ladies who have very painful cramps. Yes, so this injection decreases the cramps. It lessens menstrual blood flow. In some cases, some ladies will experience lack of menstruation completely, and some ladies will just have the menstruation as normal, but the blood flow will be less, it lessens. Also, study shows that Depo decreases the chances of getting endometrial or cancer. Okay, study shows that it decreases the chances of getting endometrial cancers. What are the disadvantages? Number one, it delays return to fertility. Okay, it delays return to fertility. Once you stop using it, or when now you decide that you want a baby, It might take you long to conceive again. Yes, it might take 3 to 4 months, and to some ladies it even takes up to 1 year to return to fertility. It doesn't protect you from getting sexually transmitted diseases. Some ladies experience weight gain. Yes, others experience high blood pressures by using this Depo. So every time you decide to use Depo, ensure your blood pressure is okay. And also every time you go for another injection, make sure your blood pressure is checked so that you ensure that it is within the normal ranges. Okay. Yes, some people say that it decreases interest to sex, or your urge to having sex reduces. Okay, so we have headaches. Some ladies complain of headaches. Some people start to experience irregular menses or irregular periods. We also have people having abdominal pains and spotting between periods. Those are some of the disadvantages. And we also have major side effects. We have prolonged vaginal bleeding. If you notice that since you started using the Depo, you are having vaginal bleeding that is prolonged, make sure you see the doctor. We also have nervousness. It is said that some people have an effect of being nervous after using Depo Provera. So you have to monitor yourself, and if you find out that you're having these major effects, just you have to go back so that you will get an advice from your gynecologist or your doctor. So a point to note, before you start getting this injection, ensure that your blood pressures are okay and you don't have high blood pressures. Okay, do a pregnancy test to ensure that you're not pregnant. Check the expiry date of the injection before you are given, and get the shot at the recommended time. If your nurse told you that you should come after 12 weeks, please ensure you go back at the recommended date, okay, to avoid getting pregnant. Okay, so that is the simple discussion of using a 3-month injection called Depo Provera. So you can see the advantages, the disadvantages, and decide whether it is the one that you want to use, or you will use. There are so many methods. Yes, and I have given you some. I'm yet to give you some more. Under these hormonal methods, we will tackle the implants. Yes, we have the one that will last for 5 years, another one for 3 years. We also have oral contraceptives. So stay tuned. Every time I post a video, make sure you watch. Okay, make sure you subscribe, and also feel free to share my videos. Okay, I have seen those friends who have shared my videos on your Facebooks. Thank you so much. Continue sharing so that everybody can get to learn. Thank you.